Liver fibrosis is scar tissue in the liver, and this typically happens after you have been affected by a liver condition that lasts for many years or decades. Liver fibrosis can be diagnosed by several different techniques. The classical way is to do a liver biopsy, which is taking a very tiny piece of liver with a needle through the skin. And this has been done for many decades, and this is still considered the gold standard for diagnosing what type of liver disease is causing the liver condition, but also to measure the amount of fibrosis in the liver. More recently, for the last decade, there are two other techniques that have gained widespread use. One is a blood test that measures certain markers of liver fibrosis. And more recently in the US, the FibroScan machine was approved, which measures liver fibrosis through a technical way of measuring the sound wave velocity through the liver. The FibroScan is considered almost equivalent to a liver biopsy when it comes to diagnosing the amount of fibrosis in the liver. It is less invasive than a liver biopsy, and it can be done immediately in the office, so that you don't have the need for a second appointment or to be admitted for half a day to the hospital. And it's painless to the patient, so it has many advances over a liver biopsy. What actually happens when you come into the office to get a FibroScan test done is that first you will see your hepatologist and we discuss your condition. The next step is, after the regular physical exam, we'll lay you down on the examination table. We'll lift your shirt over the liver on the right side, and through an exam called percussion, we will find the right location where the liver is and where we will put the probe. The probe is then placed over the skin with a tiny little bit of gel. We will fire several shots, which is a little pulse on the skin, which is painless. The machine measures how quickly that shock wave goes through the liver and calculates how much fibrosis there is in the liver. We will do this 10 to 20 times in order to get 10 reliable readings. We get an average of those scores, and the results will appear immediately on the screen of the FibroScan machine. Depending on who your physician is, they may ask you to fast for 4 hours, because this may increase the accuracy of the FibroScan result. The whole process will probably take between 5 and 10 minutes, and then we can immediately interpret the results after we're done with that test, so the results are instantaneous. The FibroScan will only measure the amount of scar tissue. If we already know the diagnosis of the liver disease, then we don't need to do a biopsy to diagnose the liver disease. But there are rare instances where the FibroScan can only tell us how much scar tissue there is, fibrosis, but it cannot give us the right diagnosis, and then we still sometimes have to do a liver biopsy. The CADC's goal to improve care for patients is served in two aspects by the FibroScan. First of all, it's a lot more convenient, less painful, quicker. We have instantaneous results. The second part is that it is less of a burden on the healthcare cost, in that it's a lot cheaper than doing a liver biopsy where you have to be admitted for half a day to the hospital.